Hey, Michigan Hosa. My name is Anya Shah, and I am your Director of Membership for this school year. Today, we have Dr. Lopez, a urology resident. So, Dr. Lopez, if you could tell us a little bit about your occupation, that would be great.
Yeah, sure. My name is Dr. Natalie Lopes. I'm a second year urology resident. I work at the University of Arizona in Tucson, Arizona / Brenner University Medical Center. As far as urology, so we deal with a lot of the aspects of the urinary system. So not only just the external genitalia, but also kidneys, bladders, ureters, the urethra, and kind of everything in between. And mostly it's the surgical intervention involved, but we do medical management as well.
That's great. Can you tell us a little bit about your position and how many years you've been in your position?
Sure. Yeah. So like I mentioned before, I'm a second year resident. So the urology residency is 5 years total. So I'm maybe a quarter of the way there now or something like that. But it's a pretty comprehensive residency. We learn how to operate, obviously, and then the operations include open and robotic techniques as well, and then clinic. So.
All right, that's really cool. And why did you pick urology? Was there something special that kind of led you to this field?
Yeah, so you know, when you're in medical school, you obviously get exposure to all of the different specialties, or at least the major ones. Urology is kind of on the side with regards to surgical residency, but I knew that I wanted to be in the OR, so it's kind of something that I personally just tried out. The thing that really drew me to urology was the fact that I could still have a sort of primary care type of interaction with patients in the office with, when we deal with typical problems like kidney stones or prostate issues. Those can be patients that you follow from year to year. So I like that part of it, but then also being in the OR and doing a variety of cases, whether it's endoscopically or open, like the big cancer cases. So
now we all know that medicine has its pros. So could you share some pros about your field?
Yeah, so I think urology in particular, there's a lot of satisfaction that comes out of most of the surgeries that we do. So I think that is really nice because we can, when it comes to like incontinence, we can help people get dry or other things. Most of the surgeries that we do, people notice an immediate effect. So it's nice to see that kind of direct correlation. So I think that in particular is like one of the big things that I like about urology.
Yeah, that's great. The job satisfaction must feel amazing. And we all know that medicine is difficult and it must have its cons. So could you share some of the negative aspects?
Yeah, so on the flip side of that, there is also a lot of chronic problems involved with urology, like recurrent urinary tract infections, kidney stones, that kind of thing. And then as the population gets older, a lot more people are a lot of older men are having prostate issues, or with obesity, there's also more kidney stone issues. So there's actually a lot more burnout that's happening among urology residents, and then attendings as well. There's just so much more patient volume compared to the number of urologists in the US.
Now, HOSA members, we are going to be entering our rapid fire round. So our first question is, what made you first fall in love with your field?
So I think in particular, it was just like I mentioned earlier, the amount of satisfaction that someone can get. So for example, the first kind of urological case that I saw was a urethral sling, which essentially helps with urinary incontinence in women. And they have pretty much an immediate response to that surgery. So just seeing that kind of satisfaction definitely kind of drew me to the field.
Next question is, what does an average day look like for you?
So as a resident, it looks a little bit different than, say, maybe an attending. But I usually get to the hospital around 6:30, 7-ish, somewhere around there. And depending on the day, you know, I have 3 days in the OR and then 2 days of clinic. So it's usually, and we'll have a certain number of patients to round on in the morning. So we'll round and then, you know, either go to clinic or go to the OR. And then that usually takes up most of the day. And in between, we take care of consults or, you know, whatever else comes up with regards to our patients. So
that sounds like a busy day, but I'm sure it's very rewarding at the end. So are there any stereotypes about your specialty?
There's plenty of stereotypes about urologists in general. We're considered the happier surgeons, which I would say for the most part is somewhat true. There's also a stereotype that there are more men urologists than female or, you know, women, which is also true. But the thing that's nice is about 50% of entering urology residents are female. So, you know, the number is increasing. So.
Yeah, that's really good news. We definitely need to get more women in the field of medicine in general. So why should someone not choose your specialty?
So I think, you know, I mentioned it kind of earlier, the burnout is really high in urology. So it has to be, you know, any field in medicine that you do, it has to be something that you really want to do. I think, you know, there are very long days. So I think, yes, it has to be something that you are truly passionate about and love doing.
Speaking of burnout, how do you manage burnout?
So for me, I try to, you know, work out as much as possible. Obviously, there are some days when I'm on call or, you know, I'm just a late day operating. I don't necessarily I'm not necessarily able to work out or anything like that. So I try to go for like a small walk outside if it's if time and weather permitting. And then I also like to set something in advance to kind of look forward to, like for the end of the week. If it's a small thing like, you know, going out with friends or something like that, that's something to look forward to get through the week as well.
Yeah, those are some really good ways to avoid burnout and manage stress. Personally, I like to also work out as much as I can, maybe read a book sometimes. I think it's really important to prioritize mental health as well. And I think us HOSA members should definitely start to prioritize mental health more and make that one of our top priorities. All right, now our next question is, what advice do you have for high school students in general? A lot of us are very high achieving and we would love to get some tips from you.
Sure, yeah. So I would say, you know, when it comes to what you want to do in the future, explore whatever you can, because, you know, although it is possible to change direction later down the road, it's good to kind of get an idea of what you like to do before you know, really start to pursue it. So I think that was the biggest thing that, you know, I've realized looking back over the past couple of years and kind of my career path. And then I would say also find something that you truly connect to, like I had mentioned earlier. Having something that kind of ties you to the field, even though there's all of these other things, all of these other problems that can come up, just having that kind of connection helps you stay grounded and, you know, willing to go to work every day. So.
Yeah, I think that's a really good point that you brought up about how like you should explore your options. I think it's really important not to silo yourself into like, oh, I really want to go into cardiology, so I'm just going to focus on that. I think it's probably a good idea to explore your options, maybe look at different fields before you decide what you want to go into. So that was some great advice that you brought up. So I think this is one of our last questions. Can you give us your thoughts on what constitutes as a good doctor?
Yeah, so I mean, there's a variety of aspects I think that go into being a good doctor. Not only being up to date on all of the recommendations and guidelines and those kinds of things from a clinical perspective, but I think also just having that bedside manner. Being willing to listen to patients and kind of hear them out, not cut them off, and then truly kind of get to know them and be open enough in your manner, in the way you speak, especially in urology. It's obviously a sensitive topic. So having those kinds of open, an open mindset helps helps you connect with your patient, and then also they might be willing to share information that they might not have. So I think that's a good way to approach things. Just have an open mind, and also, work hard, study hard.
Yeah, those are some great tips. Thank you so much. You gave us just a recap of kind of what you said. You gave us some great insight, and you told us to keep our options open, maybe explore some more, have an open mind, and just in general, work hard and study hard. So I think these are some great tips that us HOSA members can take away from. So again, thank you so much today. And HOSA members, be sure to stay tuned for our next webinar. Thanks.
Thanks.